Thanks, Chrissy. If you're considering laser vision correction, consider this. It turns out that women respond better to that treatment than men. And here to tell us why that is Dr. Charles Flowers from Flowers and Suter Vision Institute. How are you?
How are you doing, Desiree?
Very, very well. And as you know, I've had that procedure done myself. Why is it that women respond better to that procedure?
Well, it's interesting. When most people think about laser vision correction, we really, as a clinician or as a surgeon, everybody sort of focuses on being able to see 20/20 or being free of your glasses. But not everyone looks at the quality of life issues. And so there was a recent study done where they actually looked at the quality of life issues. How is life after you've had your surgery done? And they found that in general, women tended to score lower on quality of life issues prior to surgery, and then afterwards they scored higher than men after they had their surgery.
Really? Now, what are we talking about when we're talking about quality of life?
Well, what was happening is that investigators administered sort of a 20-item questionnaire where they looked at various issues of being confident, doing different things, being able to see when you wake up in the morning, feeling happy, being confident, all these different items. And they looked at
feeling good about yourself?
Feeling good about yourself. And in fact, when people think about it, most people's motivation to do laser vision correction has to do more with the quality of life issues than sort of being able to see. I mean, in your instance, would you say that it was quality of life?
Quality of life. I hated having to always worry about the contact lens solution whenever I traveled and bringing everything with me, being stuck somewhere with my contacts in and my eyes hurting, not having my glasses around. I mean, it was a mess all the time.
Exactly, and that was a big issue for women, always having to think about their eyes when they decided to do something. That was a huge issue for them, and they found that after the surgery, it wasn't an issue, and they were very happy with it.
Okay, so that's where all of this came from. It's a quality of life issue. But what about just in terms of the treatment being effective and being able to recover? Was there any difference in men and women?
No, there's no difference there for the most part. I think they scored equally there, but it was just the issues that women seem to be a lot more benefited a lot more with respect to quality of life issues, which I think is very important, because that when I see patients in the office, most of it revolves around what their motivation really revolves around their quality of life issues. They can see okay with their contacts and glasses, but they really want to be free of the encumbrances.
Okay, well, obviously those are very important issues. If folks are still considering laser correction, obviously they can give you a call. You'll have a lot of information for them, and we'll send you to fox6.com. You can get in touch with Dr. Flowers there. I'm sure he'll answer any of your questions, and thank you so much for coming in, as always.
You're welcome.
Appreciate it.